Swaibu Semakula in 2002 discovered he had HIV. The world became smaller. He found solace up on this tree for 30 minutes before deciding to return home.
I was confused. I never told my wife for 4 months and my health deteriorated.
To Dr. WAGNER, a behavioral research scientist with Ranch Health, Swaibu had started suffering from depression.
As the depression becomes more severe, people become bedridden. We've seen clients that become so depressed, so the depression becomes so painful that they want to take their life.
Swaibu experienced all this. He was in disbelief to the extent that he stopped taking medication. Taking the drugs to him was proof that he was indeed sick.
I stopped taking drugs after 3 days.
A mistake driven by depression, of course, according to Dr. Dickens Akena from the Department of Psychiatry at Makerere University.
If they don't adhere to their medications, the viruses become resistant, then they get passed on.
Not only become resistant, but to grow. So they have a lot more virus in their blood, and that makes them a lot more infectious. Depression can fuel the HIV epidemic. People who are depressed are less likely to use condoms, right?
UNAIDS estimates of 2013 put Ugandans living with HIV at 1.6 million people. Now, according to the Minister of Health, Mildmay Uganda, Rand Corporation USA, as well as Makerere University, over half of these have elevated symptoms of depression, and 1 in every 5 requires treatment.
Once they are receiving HIV treatment, antiretroviral therapy, that for some, that's enough to improve. For those that remain depressed, that's where we need to have access to, mental health treatments.
For 2 years, under the INDEPTH Uganda research project, researchers have been working with 10 HIV care facilities to prove that it's possible to integrate antidepressant treatment into HIV care across most facilities in the country. Though he did not get antidepressants, Swaibu managed to regain his footing.
Uganda has 1 psychiatrist per 1 million persons. But the psychiatrist is not the only person who should be able to provide mental health care.
And we are not going to apologize. We are going to tell the health workers they need to go to what they learned, that you assess a patient, assess all systems, and treat them for all the conditions which you identify in one go.
A combined approach gives the best outcome. So we will give the drugs, antidepressants. We also talk to the patients in terms of psychotherapy or counseling.
Prior research done in Uganda by Mildmay and Rand Corporation also saw an improvement amongst people with HIV suffering from depression after researchers assessed and treated them using antidepressants. They did not have to send them off to Butabika, the country's main mental institution, to be treated independently for depression. Florence Naluyimba, NTV.